Hey y'all, what's going on? This is J Marie, J Marie Booklist, and today I'm making a video about transferring patients to another hospital. This was a requested video by one of the viewers, and I guess the question was, what do we do when a patient is being transferred, like to another hospital? What is it that we do personally? And I was thinking about it because we did transfer a lot of patients from the ICU to other hospitals, and not necessarily, because we transfer them to SNF. We discharge them to SNF, but like a transfer to another hospital, meaning they need something more. I did make a video about when a patient is airlifted to another hospital, like when a baby, in ICU, they need more care than we can give them at our hospital. I did make a video about that when they're airlifted. But as far as a transfer, I mean, it happens. I saw it more when I was in the ICU. And but the number one thing you will usually see is when they're like discharged to a SNF or something like that. So, but being transferred to another hospital does happen, and usually, at the hospital, the case management handles all that. So once the doctor puts the order in for the patient to be transferred, the case management would get on that and handle that, because they have to the now usually in the ICU, and not necessarily the ICU, but this is where I saw it the most. The doctor, so if they were transferring the patient to another hospital around here, the doctor would call. So like, let's say the doctor have privileges at our hospital, and then they have privileges at like two other hospitals in the area, and they want to transfer the patient to the other hospital. Well, they would just call, one of the other doctors that they know, hey, John, this is Bob, because they know each other on a first name basis. So they say, hey, I have a patient, blah, 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 blah. Will you take the patient? Because you got to have an admitting doctor at the other hospital to take that patient. And so usually they would. So usually they know each other. So the doctor will put the order in to transfer the patient to another hospital, but the doctor has already communicated with that a doctor at that facility to take that patient. Now there are times where the patient has to go to a facility and is not anywhere near here. I saw that many a times in the ICU, like when they were transporting the patient on helicopter. They had to usually it was case management getting involved and the house supervisor getting involved. And so usually, they would call and they would have to work it out with a doctor there to accept that patient. So if we're down here in South Florida and we're transferring a patient up to Gainesville, well, the doctor here don't know any doctors there. So, you got to get case management involved, house supervisor, nursing supervisor got to get involved, because that's a whole nother level. Same thing if, we're here and we're transferring a patient down to Miami. That's a whole nother level. I mean, do the doctors know doctors down there? Yeah, they do. But, it's a whole nother thing. But if it's like I'm sorry, hold on. But if it's a doctor in this area and they know each other, that's usually what they do. So once the doctor puts that order in, case management gets involved. Nursing supervisor may get involved. Just all depends on where the patient's being transferred to. And but like, we're going to talk about if they're transferred around here, within your area. So case management gets involved, and house supervisor may get involved. Just all depends. At our facility, the case management had people who worked actually in the office. So it was like you had the case management department that was like down in the basement, and then you had case managers all over, and then we had an area where some of the case management set. I don't know why they set up there, but they finally moved them down to the basement where the rest of them were. I don't even know why they were all over the place. And they would go around, like say they needed medical records. They would get what they can get from the computer and print it out, And then, they would come over and get the chart, and whatever was on the chart that wasn't in the computer, they would make copies of that. And then they would put the chart together in a like a folder, so to speak. I'm trying to think what you call it, like a big envelope. And it would have, the patient's name, because it would have areas you can fill out on the front of the envelope, and the patient's name, where they're going, their date of birth, just everything, and all their medical records would be in there. Now I want to say there might have been like a 1 or 2 times where I made copies from the chart. I printed out stuff. I know I did it for when we were doing organ donation, like when they were gonna take a person's organs after they died. I know I printed out a lot of stuff. And so usually, you can do that. You may be asked to print stuff from the chart and make copies from the chart, but that's rare. Like that wasn't a everyday thing, because like I said, case management had people who did that. And then so they will put it in a big envelope. They will also request a CD of the patient's x-rays, radiology, any type of test like that where the patient went off the floor, chest x-rays, radiology, ultrasounds, anything like that, they will request it and will have it put on a CD. Now, I did that a lot. Because I worked the weekends. So it was a skeleton crew, and case management, like it would be everybody running around trying to get, this chart together, because the ambulance is going to come and get the patient at a certain time. So we're trying to make sure everything's together. Mostly everything was together. The paperwork was in the envelope, and but we were just waiting on the CD. And so I would go down there to Tony, and he would, I would call down there and say, hey, we need a CD for patient, first name, last name, date of birth, room number, MR number. I think you always get an MR number, and we need everything. And so he would, he said, give me 20 minutes, and he would make a copy of everything, and then I will go down and pick it up. And then I will put that in the chart, so in the envelope the envelope packet, and then we will put that on the front of the chart. I don't know if anything else, but it will already be filled out because it's on the front of the chart, like literally on the outside of the chart with a rubber band, so nobody can miss it. And so I will put that in there, and then we would just wait for the ambulance to come, and we give them that envelope, and then they put the patient on the stretcher and take them over to the other hospital. That's usually how I went. So I mean, it's kind of, because I'm trying to think with the sniff. Yeah, I mean, that's pretty much how you transfer them. But usually, like I said, the doctors, if it's in the area, they will call each other and say, hey, like the cardiologist might call, they working everything out. Hey, I got a patient over here. Will you be the attending? And then, of course, the doctor, if that doctor has privileges at the other hospital, they will go see that patient. So, like, say a cardiologist wanted the patient transferred, they will have someone be the attending doctor over there, the primary, the hospitalist. But then that doctor, that specialist would still go over there and see the patient. It was just, stuff going on. And that did happen because, it'd be, yeah. And doctors don't want their patient over here. They want so they going to take their patient and go somewhere else. And so that has been known to happen. But that's usually how it goes. It's usually nothing too difficult. That's usually how I go. But like I said, most time you would be dealing with patients being transferred to a SNF or ALF or things like that. But as far as transferring, I mean, it happens, but it's just, there's a reason why it happens. The doctor, there could be a procedure that can be done at another hospital. And like I said, we saw that. So that's why we, I saw that more in ICU than on the main floor. But That's usually how it goes. All right, y'all, this is J. Marie, and I'll talk to you later. Bye.